Hello, everyone. I'm Gary Summers, and welcome to the audio edition of Mind, Body, Soul, a show about your mental, physical, and spiritual wellness. Well, I have another great guest today to talk about naturopathic medicine for brain health, and I have Dr. Brigitta Ziemba with me online today. And welcome, Brigitta.
I'm so excited to be here with you.
Well, you come highly recommended, and certainly naturopathic medicine is in the forefront of a lot of people's mind, and that's what this show is all about, to look at holistic ways of being able to help people. So before we get into this, Brigitta, just tell us a little bit about what you do and what listeners can expect to hear from you today.
Yeah, so my name is Dr. Brigitta. I'm a registered naturopathic doctor and I'm a former primary care paramedic. And I have a focus in helping individuals braving chronic pain, concussion recovery, mental and cognitive decline, reclaim and optimize their resilient brains naturally. And I'll be sharing what naturopathic medicine is and how it can support brain health. So everything from mental health to concussion recovery, stroke, dementia, and Parkinson's, to name a few. And I know naturopathic medicine isn't usually on people's radar, and we're not usually considered part of the care team, but I'll share how that we can be a big piece of that as well.
Because we hear dementia in the news a lot, and I just had a really good friend of mine diagnosed with Parkinson's, and I always say to people, it's nice to look at options and not to just put all your eggs in one basket, because people only know what they know. People don't know what they don't know. Just because someone tells you this is all that they can do for you, that doesn't mean that that's all everybody can do for you. It just means that they, under their scope, they've exhausted everything that they can do. So it's certainly nice to keep an open mind. And that's what I always say to people, is to keep an open mind, because, if you believe that there's an answer to every problem, just because you haven't found it doesn't mean it doesn't exist. It just means you haven't talked to the right person.
Mm-hmm.
And in some cases, you could be the right person.
Absolutely. And you bring up a really interesting point because, coming from an emergency medicine background, I have nothing against medical doctors, but everyone has a very special lens they view things through, right? So medical doctors are very specifically trained. And if I always say, if the only thing you have is a prescription pad, then really your options are very limited. And as you mentioned, there's other practitioners with various different tools, right? So we all bring unique tools to the medicine and to people's conditions, and we look at things with different lenses. And as if you keep your radar open, there can be different solutions, as you mentioned.
And doing some research and looking at what the training and education and the amount of classroom hours that a naturopathic doctor has to go through. I mean, that's a lot of training. So just explain, what is naturopathic medicine? What's the difference between a naturopath, because we have lots of naturopaths out there, and a naturopathic doctor?
Yeah, so there's certain provinces where naturopathic medicine is not I'm totally lost for words. So naturopathic medicine is not regulated.
Right.
That's the word I was looking for. Sorry.
Yeah.
So when you get to east of Ontario, it's not regulated. So that basically means most people can call themselves, whatever training they may or may not have, can call themselves a naturopath. So that really leaves it up to the patient to do their own research and to look into what that looks like for that person. So there's no oversight, unfortunately. Naturopathic doctors, on the other hand, we've completed 4 years of additional training on top of our undergraduate degree. We've done licensing. We're part of a regulatory college, so there is oversight as well. We have to maintain our continuing education. So with that being said, we're able to have access to a lot more things as far as lab work requisition and functional medicine testing and things like that as well are in our scope.
So what are some of the tools in your toolbox as a naturopathic doctor? Talk about who would be the clients that you would see. What would be I know you talked about Parkinson's and dementia and things like that. So just give us a scope of the degree of what your day kind of looks like.
Yeah, so a lot of people I see do come to me for, so naturopathic doctors are primary care providers and they're trained as generalists, but a lot of us have chosen, or something has chosen us, or had, there's a calling for each of us, for most of us, I would say. And for me, that really is brain health. So I see a lot of post-concussion patients that are struggling with persistent concussion symptoms, everything from patients with MS, Alzheimer's, chronic pain. So really, I use my toolbox of everything from nutrition, lifestyle medicine, hydrotherapy, and homeopathy. Botanical medicine is fantastic when it comes to brain health, and manual therapies as well. So I've pursued additional training in cranial sacral therapy and sports nutrition, and I also do injection therapies for pain management with a lot of my chronic pain patients, because that could be a big piece, especially when it comes to concussions.
Do you see many people with concussions? And how would someone know if they have a concussion or not? Because when I was growing up, you fell down, you hit your head, you didn't feel very good, but the coach said, "Hey, get back out there, you're all right. Just go, just
Absolutely.
just go, right?" So, I mean, is it possible for someone to have a concussion and they don't even know they have it?
100%. So actually the definition for concussions, and you're absolutely right. Like when I was a kid,
Yeah,
I look back and I was like, oh, I did have a concussion, but
yeah,
it was not a thing, right? You just walk it off. That
yeah.
was that
I
was the
mean, now
recommended treatment.
and now with professional athletes, there's a concussion protocol, and you have to go through all these rigid things, and you look at some of the in particular hockey players. I mean, they could be out with concussion related things for months.
Absolutely. So when it comes to concussions, going back to what you were asking is,
Yeah.
how do we diagnose a concussion? So a concussion really is, so all you need is to have a mechanism of injury. So where you hit either in the head or in the body. So was there force that came in? And you have a symptom. So a symptom can be a headache, it could be nausea, it could be feeling just unwell or dizziness. Um, and really, that's all it takes to really be diagnosed with a concussion. There's obviously red signs that we look for, like if people are losing consciousness or seizures, or they're more lethargic than normal or vomiting, then those are the really obvious signs. But you're absolutely right. It's easy, I think, for people to just think, oh, maybe I didn't have one, or there could even happen very frequently with car accidents as well when there's a whiplash injury. So that could be a big piece of it as well.
So does it always involve a blow to the head?
No, so the force can come in through the body. So this is often something you'll see in contact sports where individuals are hit in the body, and just it's actually the shearing force. So it's often thought that concussions are a bruise to the brain, but what we know now, it's more of a shearing force that happens to the brain cells themselves. So the brain has, for clear, or I guess for simplification, oversimplification, we have gray matter and white matter, and they're
Hmm.
different densities. So if we kind of think of it like jello, and the brain moves, the actual cells in the brain stretch. And so the things that should be inside the cell leak out, and what should be outside leak in. So then the body, the brain, those cells are trying to adjust. Basically, they're trying to re-regulate. And in the process of doing that, it takes up a whole lot of energy. So that's why people often feel incredibly fatigued post-concussion, is because it's a massive metabolic imbalance. So as much as there's a physical component to a concussion, the biggest piece is that physiologic metabolic component. And that's where my work really comes in, is helping with that inflammation cascade that gets started. And then there's an immune cascade that gets started, and really helping bring down that inflammation, and really helping the body and the brain repair itself. So while the hands-on therapy is absolutely important, this is kind of the other side of the puzzle that is often not looked at.
So you've just enlightened me to a
Mm-hmm.
concussion, and I would suspect that the vast majority of people would assume that it's a blow to the head. But I mean, a simple rear end collision that causes a whiplash can cause like that white and gray matter to kind of bang up against each other, and
Yeah.
then there's that unequilibrium, and you got that problem going on in your head. So yeah. So um, talk about naturopathic medicine and how it supports concussion recovery, memory loss, neurological conditions. So, because I mean, people, I guess, walk around. I mean, if you broke your leg,
Mm-hmm.
right? If you have other issues, but sometimes when it comes to the brain, you really have to be so careful. And even when we talk about dementia and early onsets of dementia. And I guess that will lead into another area if we got some time. So yeah, just talk about what you do to support concussion recovery, memory loss, and even talk about maybe some specific neurological conditions that seem to be prevalent and that you see.
Yeah, absolutely. So a little bit of what I mentioned before is more of that metabolic piece with concussions, and similar, there's different metabolic cascades that happen. So with Alzheimer's and dementia, you get a buildup of different plaques and tangles, as we like to call it. But the reality is, so just even through normal daily function of our brain, the brain creates its own weight in metabolic waste per year. So that needs to be cleared. So when you add something like a concussion in there, and there's actually an increased demand for energy, that creates additional waste just in the process of how these cycles work. So those, if they're not being cleared properly, end up really building up in the brain. And then we can see things like post-concussion syndrome. When there's blood sugar imbalances, those can also lead to Alzheimer's, dementia, as well. And then certain neurological conditions such as multiple sclerosis, Parkinson's, there can be underlying autoimmune conditions as well that happen. So the body in of itself starts to attack some of those neurons and the central nervous system in some of them. So really, it's a lot of it is addressing the inflammation that is happening, making sure that we're also addressing any deficiencies, because a lot of neurological conditions or a lot of deficiencies can show up as neurological conditions. So I see this a lot in the persistent post-concussion patients, where they're coming in, and especially in females, where let's say their iron is really, really low. Well, now if you don't have enough iron in your red blood cells to transport oxygen, you're not getting oxygen to your brain adequately, right? So it's addressing these key pieces of like, is it just a nutrition deficiency that needs to be corrected that's showing up as post-concussion syndrome, for example? Or is it a blood sugar imbalance that's driving these symptoms for some of the dementia Alzheimer's patients, or a dysregulation of it constantly? So really it's addressing those root causes. And then furthermore, it's also, when we talk about mental health, there's always a mental health component to most of these conditions as well. And so really looking at that whole gut-brain axis, it's said that the gut is the second brain, and there's that direct connection that happens through the vagus nerve, which is our longest cranial nerve. So there's actually a physical connection, but then most of our nutrient absorption happens in the gut. Our immune system is in the gut. So all those things, and post-concussion and post-trauma, the gut can become leaky within several hours. So now there's a source of chronic inflammation that can happen because larger molecules that shouldn't be getting into the bloodstream do. So those are always things to consider. So I'm actually working a lot with the gut for everything from concussion patients to even like multiple sclerosis patients and Alzheimer patients, because that could be a major source of inflammation and lack of absorption for patients as well.
The couple of things that you said, which to me was like a concussion can lead to an autoimmune response.
Absolutely, it can.
And I mean, when you get autoimmune, I mean that's very problematic, isn't it? You also mentioned about gut health, and a lot of people don't realize how much the gut is connected to health, because I think I read somewhere, and you correct me, 75%, 80% of serotonin is produced in the gut.
Yep.
So, we sometimes don't think enough. We have an upset stomach and chronic, and then you get bloating, and then you think that, well, it's just, and then you put Pepto-Bismol down, and then it makes it even worse, and then you go to the doctor, and he prescribes something when really it's probably your diet that's creating creating the problem, isn't it?
And that's the thing, is I think a lot of people don't realize the food sensitivities that can be going on in their gut. Like you said, I think most people have just learned to manage it with Tums or Pepto-Bismol or whatever it is, or they just generally feel lousy after they've eaten a meal, and they're like, oh, this is just my normal. Yeah. But normal definitely doesn't mean that, or it's their typical. It's not what it should be, right? It's not optimal, that's for sure.
You go with acid reflux, and you're given a prescription to kind of dry up, get rid of the acid, when maybe the problem is that you don't have enough acid for
100%.
digestion, right? So the
100%.
food can't digest. It can't open up and go down. So there's only one place for it to go, and that's to go up. And then of course you get oh well, that's not working. So okay, well then we'll increase your dosage and create even more problems.
Yeah,
Right?
and then it creates nutrient deficiencies like B12, for example, and that's a big one for nerve health.
Yeah.
So then it's like it just becomes this vicious cycle.
Yeah. Yeah.
Yeah.
And then you wonder why things are not getting better.
Mm-hmm.
You mentioned you're also a craniosacral therapist. Share what craniosacral therapy is and how it can support various brain disorders.
Yeah, so cranial sacral therapy has often been dubbed massage of the nervous system. And it's a branch of osteopathic medicine that uses a gentle hands-on therapy that works with the body's cranial sacral rhythm. It nourishes the central nervous system, which is our brain and our spinal cord, and it improves overall health of the tissues and well-being. It's incredibly powerful in that it can shift the body into a parasympathetic nervous state system, which is a very powerful healing state. So when we're stuck in that fight, flight, freeze response, that's our
Yeah.
sympathetic nervous system. And then our parasympathetic is that rest, digest, and heal.
Yeah.
So I see this a lot with post-concussion patients because there was a trauma. The body sits in that chronic sympathetic nervous state. So there's a lot of people are complaining of digestive issues or heightened noise and light sensitivity. And that's because the body is stuck in that constant arousal, or even PTSD is a perfect example of that, and anxiety. So helping the body shift into that parasympathetic state is where the body can actually say, okay, I'm safe. And now I can actually focus on healing because I'm not worried about running from that bear. So that's really, and it's a beautiful piece. It also helps with opening the drainage pathways. So because our brain does produce so much waste, if there's structural misalignments anywhere, from anywhere within our cranium and within our spinal cord, that really limits the flow of the cerebral spinal fluid, which is the beautiful fluid that bathes and nourishes our brain and our spinal cord. But also we're looking at blood flow and nervous impulses as well. So any misalignments, whether it was actually like a major trauma or even just normal like compensations, you see it a lot in athletes where if they're always like hitting a baseball from one side or using hockey stick on one side, their body will overdevelop on one side. So that's going to naturally create imbalances. So really it's helping the body and the nervous system to readjust to, I guess, a more balanced state. And then on the same token, when we're looking at Alzheimer's and dementia, it helps actually move that lymphatic fluid or the cerebral spinal fluid through. So it helps flush out the toxins.
Is it similar to, so can you just describe the therapy? Because I've heard terms like Indian head massage.
Mm.
What would you do if you were going to do this type of therapy? Just briefly describe what it looks like to our listeners.
Yeah, so my patients would be lying on a massage table, fully closed. Usually I have a blanket on them because when the body relaxes, it tends to get a little bit cold, but it's a very gentle hands-on therapy. So it works really with the tissues and the fascia, and the pressure varies depending on what the tissue needs. So that's something that I connect with the tissues and see, okay, what does the body need and where do I actually need to work? So let's say a lot of people will come in complaining of like shoulder pain. And when I actually assess the body, the shoulder might be the place that's compensating, but the original issue might be at the hip. So then I'll actually work at the hip to correct that imbalance, and then the shoulder will in and of itself release. So what's really neat about it is we're not chasing the symptoms. We can actually get to what's causing the underlying imbalance. And then the nervous system is usually very good at holding those corrections. So it's not like I need to keep coming back and working on the same areas. But some people do fall asleep, and that's okay too. But yeah,
as long as you don't fall asleep, right?
I don't fall asleep.
That's what's most important.
But no, it's a very calming therapy. So it's just a nice option for people. Acupuncture is part of my scope as well, but some people don't like needles, or some people don't like chiropractic, whatever it is, right? People just have their different, or whether they don't want to go to a massage or whatever the situation is, just another option for people
Sure.
as well. So,
Yeah.
yeah.
And I guess that's when we talk about a holistic approach, that's really what you're talking about here. You come in and you have a sore shoulder. Oh, I got to, here's some pills that'll eventually go away, but you're not correcting the source of the problem.
Right.
Yeah. It's like you have a leak in the ceiling, you put some tape over it, and after a while the leak comes back. I think people, it'd be nice, it's nice for people to realize that we do have more control over our health than we think we do, don't we?
Mm-hmm. We have so much power, and so much, like, coming from the conventional medical system, so much of power has been taken away, and we've given it away, right?
Yeah.
To people
Yeah.
in white coats that have
Yeah.
said either you're healthy or you're either sick or you're not, right? And this
Yeah.
is a whole different paradigm where we're saying, okay, there's a whole different range of not sick, right? There's so much you can do to create your health. And
Yeah.
that's really what it's all about. It's not just living in a world where I'm like, oh, I'm not sick. But when you go to the doctor and you're like, the conventional system really is like, I don't go to the hospital and say, hey, I feel like a 6 out of 10 today. I want to feel like a 10 out of 10. They're going to look at you and be like, what's wrong with you, right?
Exactly. Yeah, exactly.
But then people, yeah, I was going to say, and people will come to me and they'll be like, I want to optimize my brain health, or I have a family member with Alzheimer's, and I don't want to go down that path. And that's really where my work comes in.
And you made a good point. And I think to focus on that and just to reemphasize that more, just because you're not sick doesn't mean you're well.
Right.
That's really the
Bingo.
Right. And I think that's what people need to realize is, we have one shot at this. Mm-hmm. And, you want to do everything you possibly can to make that the best shot you possibly mm-hmm. can. Brigitta, as we finish up here now, I always ask my guests to give our listeners some advice that they can use now that can help them, deal with whatever adversity that's going on in their lives, whether that's mental, whether it's physical, whether it's spiritual. What can someone do right now to kind of get on the right track?
Yeah, so my top 3, my big one is drink water. I always get super excited about talking about hydration because 75% of North Americans are chronically dehydrated. And the symptoms of mild dehydration often show up as brain fog and memory loss and fatigue. And when we're looking at those drainage pathways, the cerebral spinal fluid, our lymphatic system, as well as our immune system, if our body's dehydrated, it's a source of stress. So I think most people are not drinking enough water. So that's a big one. And we don't want our brains to be raisins. So please drink some water. So that's a huge one. Because the symptoms of dehydration just mimic so many cognitive symptoms. So drink more water. And what that looks like, actually, because I think this is an important piece. So urinating every couple hours, and your urine should be pale to clear yellow.
Yeah.
So when they said, okay, like 2 liters, they pulled that number out of the sky. So it's a more useful
so look at
guideline. Yeah.
Look at the color of your urine, and if it's dark yellow, then you're not drinking enough water.
You got it.
Pretty simple.
Pretty simple. Getting outside. I know we have days where it's not so wonderful, but even just sticking your head out the window or sitting in a window and leaving your electronics at home or not checking them. I think being able to disconnect from everything that's going on and all the noise in the world and actually reconnecting with the present and Mother Nature is so powerful in calming our nervous system. And that's a huge one, whether it is for mental health or just even all the screen time that we're used to these days. Just for nervous system regulation, getting outside is massive, and being present with what's going on.
Yeah, go ahead. Sorry.
No, go ahead.
Yeah, so we spend so much time worrying about what happened to us, or worrying about what the future holds. I remember a quote from Red Skelton, the great comedian. I used to watch his show when I grew up. He said, "There's 1,000 yesterdays. There might be a tomorrow, but there's always today." Mm-hmm. And so that really stuck with me. Brigitta, thank you very much. As always, every single one of my guests, I feel like I get therapy every time I sit down and talk to somebody. It's been a wonderful experience, and welcome on board. And you're certainly welcome at any time to come back and talk more about what you do.
Thank
Thank
you
you.
so much, Gary.
And before we sign off, as our listeners are listening to Brigitta, all her contact information is being displayed as she's spoken. So if she struck a nerve with someone and you want to get in touch with her, all her information is there. So thanks again, Brigitta. And that's it for everybody. We'll be back next week with another interesting guest.